just describe for us, please, what you're seeing today in terms of mental health crises in Dover. And Chief Breault, if you could go first, please.
Sure. Well, again, good afternoon, Laura, and thank you for inviting me to participate today. Specifically to the police department, what we're seeing is over the last several years, and I know it's true for the fire department and emergency services as well, and it certainly isn't just here in the city. It's really throughout the region, throughout the state, and nationally. I think it's a trend that unfortunately is continuing. But we've seen an increase in mental health related police calls for service and fire and EMS calls for service. We know this through our calls for service. And we've also realized that mental health, substance misuse, and homelessness are all somewhat intertwined. So as over the last 10 years or so, as we watched our calls for service and the trends for our calls for police services, we've seen an increase in a lot of calls. People don't call the police or don't call the fire department to say, hey, I'm suffering from a mental health crisis. Can you please help me? They present in a whole bunch of different fashions. So it may be domestic violence. It may be a EMS call that somebody has a medical aid issue, when in reality, the underlying issue is their mental health. So there are certain calls that we track over time that really show us that there is a direct correlation to mental health, homelessness, and substance misuse. And for us, those are calls such as well-being checks, assistance calls, non-criminal calls in nature. We've seen over the last 10 years a 207% increase in well-being checks. Those are times where either an officer directly observes somebody, or we get a call about somebody's welfare. Somebody just isn't acting appropriately or the way they should be. They don't call in necessarily a crime, but an officer is dispatched to go and check on that person. So we've seen a 200% and 7% increase there.
Wow, that's huge. Yeah, go ahead, Chief Breault. Yeah.
We've seen an 85% increase in suicidal subjects over the last 10 years and a 285% increase in trespassing and vagrancy. So obviously, most of these are non-criminal calls in nature, but they're really driving the increase in calls for service that we're seeing. So we're definitely seeing, this is putting more of a strain and more of a tax on not just police services, but fire services, our local emergency rooms, and that increase seems to be continuing. So we really need to take a look at how can we better respond to those things.
Seeing exactly what Chief Breault described, except we're seeing it in younger people. So our need for mental health and substance misuse services have doubled at the midpoint of this year from last year. So we'll see that number
that's a
at the
lot.
end of last year. It is. We're seeing an increase in parent referrals for students to get mental health services in school, student self-referrals, suicidal ideations. This year alone, in our high school population, we've had 29 students hospitalized for mental health supports. At any given point in time, I have a student in the emergency room waiting for a bed. And I think that's a remarkable thing to think about, that our kids are spending 7 to 10 days in the emergency room before they can access a hospital bed. And we're seeing it in younger students. I've been with the district 14 years. When I started, I don't recall suicidal ideation in kids under 5th or 6th grade, and now we're seeing them at the elementary level. So the intensity and severity has just really increased since returning from the pandemic.